Infertility and scant menstrual flow. Normal menstrual flow for a woman is typically around 25 milliliters per period, roughly one package of sanitary pads. If the flow is less than a package and appears dark, it indicates scant menstrual flow. Scanty menstrual flow can lead to infertility. Insufficient flow suggests issues with the uterine lining or endocrine system, requiring a thorough diagnosis for proper treatment. One primary cause is uterine cavity adhesions. Scanty menstrual flow can lead to infertility. Insufficient flow suggests issues with the uterine lining or endocrine system, requiring a thorough diagnosis for proper treatment. One primary cause is uterine cavity adhesions. Cervical canal adhesions can also obstruct blood outflow. These conditions necessitate endocrine tests, hysteroscopy, and potentially uterine iodine oil contrast in panoramic 4D color ultrasound for precise diagnosis. Scanty menstrual flow, especially secondary cases, often results from secondary injuries to the endometrium and is challenging to treat. Hormones and traditional herbal remedies often prove ineffective due to the localized structural damage. Beijing Antai Hospital employs hysteroscopic adhesion release, scar tissue excision, and the application of biological anti-adhesion membrane and L-shaped support to restore the uterine cavity. If these interventions do not restore normal menstrual flow and fertility, or if the patient experiences natural miscarriages after conception, uterine endometrial transplantation, a unique technique at Beijing Antai Hospital, may be performed. Successful tissue matching ensures the transplanted endometrium covers the uterine cavity, thus restoring normal uterine function. For stubborn cases of scanty menstrual flow and uterine adhesions, even uterine scar damage, this technique offers a promising solution. In cases of unsuccessful transplantation or unavailability of suitable donors or endometrial sources, gestational surrogacy can achieve reproductive goals. As the ovarian function of the patient is intact, retrieving eggs and implanting them into another woman's uterus can result in successful pregnancy. If scanty menstrual flow is not treated for fertility purposes, it may not significantly impact overall health and lifespan. Conditions such as pituitary tumors or hypothalamic disorders causing scanty menstrual flow can be diagnosed through head CT or MRI scans, along with hormone tests. A precise diagnosis is essential before embarking on treatment. Beijing Antai Hospital adopts a signed treatment approach, with a full refund in case of unmet goals.